reform could not be any bigger. The natural question is whether the president will bring the fighting spirit to match it. But on our fourth story in the countdown, 24 hours before his speech to a joint session of Congress, still no firm indication that President Obama will deem the public option as essential to health care reform or will not. This as Speaker Nancy Pelosi and the House Majority Leader contradicted each other on whether the public option is politically optional. The Speaker and the Senate Majority Leader, Harry Reid, met with the president today. Speaker Pelosi saying the House is prepared to combine its health care bills, all three of which include a public option.
I believe that a public option will be essential to our passing a bill.
But Speaker Pelosi also said that what happens in the legislative process is another matter. Senator Reid said the Senate was for the public option or something like it. And he pushed the White House argument that health care bills across the House and Senate agree on most provisions, 80 to 90%.
We want a bipartisan bill. We do not want to do reconciliation unless we have no alternative.
Meanwhile, the number 2 Democrat in the House, Congressman Hoyer, today said he could envision a bill without a public option, even though he has been and still claims to be a strong supporter of the public option. And a few members of the House Progressive Caucus who once insisted on the public option have now indicated some willingness to support a trigger. As for the president, aides leaving no doubt that he will be more forceful and quite specific in tomorrow night's address. But will the public option get more than a one-line mention? That's how much time it got yesterday when the president spoke to the AFL-CIO in Cincinnati. Time now to call in our own Lawrence O'Donnell, contributor to Huffington Post, former chief of staff to the Senate Finance Committee. Lawrence, good evening.
Good to be here, Keith.
So which is it? In the House, could a bill without the public option pass per Hoyer or not per Pelosi? And is the White House for us or against us at the moment?
Well, the White House is for a bill, Keith. The president is with the public option, but he would happily sign a bill without the public option. Rahm Emanuel's made this clear from the start. Since January, Rahm Emanuel has been saying publicly the most important thing is to get a bill. That's a bill with anything in it that involves the health care sector. It does not have to include the public option for the White House. That's actually been very clear from the beginning on this thing. Remember, it has to pass the House twice. It has to pass the House once to get it into conference with a bill from the Senate, and then it has to pass the House again in final passage. It might go through the House with a public option the first time if Nancy Pelosi feels that her troops demand that, but I don't see any way it will go through a final passage with a public option. I have strong doubts that the House, that even for the first passage, that Nancy Pelosi will insist on the public option.
We also keep hearing that the White House has been frustrated that the public option has gotten far too much attention, in its opinion, in this entire debate. How did they misread this? It seems that the public option is the hinge on which forcing insurance prices down exists or does not exist.
Well, what they misread, Keith, was how much uproar this would cause on the left. And they were using the old playbook, the 1994 playbook. And what you have to remember about 1994 is there were no blogs in 1994. And for the 15-year-olds out there, I hate to tell you, but MSNBC did not exist in 1994. And so when we were legislating this in 1994, we did not worry about risking the wrath of the left if we were trying to move the bill toward the middle, because we knew the left would have to be with us in a vote when we actually get to the Senate floor or on the House floor. That's the normal formula, that the Democrats don't worry about the left. And that is the formula that they're using this time. Nancy Pelosi firmly believes that when the moment comes, she can gather her caucus together, tell them that she fought harder for the public option than Barack Obama did, than Harry Reid did, than any senator did. No one fought harder for it than Nancy Pelosi, and she is now telling her troops they're going to have to go forward without it. That moment is going to come.
But there's still there's a calculation here in the other direction that doesn't add up either. Assuming no Republican votes in the House, the Speaker can only afford to lose 38 Democrats. 23 Blue Dogs said they will not vote for the bill as it now stands, but there's 60 to 100 Democratic members, progressives, who might bolt without a public option. Doesn't both sets of math fail her?
They do, but what she believes is, and what they always believe in the Democratic Party, is that when it comes down to the actual legislating moment, they will get those 100 liberals in the House to go along with this more centrist position. They'll give up on the Blue Dogs, and they'll simply talk to that 60 to 100 voters on the left in the House to be on board with this and be on board with this president, and it will work because it always works.
Is it going to work this time?
I don't see how it wouldn't work. If Nancy Pelosi gets it to the point where the only way to get this through is without the public option, and she gathers her caucus together and she tells them that in one of those hold hands prayer meetings, in effect, and Charlie Rangel, who's been very strong on this and chairman of the Ways and Means Committee, stands up and says we've got to do it this way because that's what chairmen always do. Chairmen want to get a bill in the end, and they will basically hold hands and say let's do it this way.
And what happens then on the left and perhaps in the middle and to some degree on the right when a bill passes that doesn't have a public option and thus basically forces more people to buy over-the-counter insurance from insurance companies that are not seriously regulated because there is no public option? What do we have then? Protests in the streets?
And does not provide universal coverage. What's been lost in this discussion all year is that none of the bills that have come out of any of these committees actually provide universal coverage. And so in the end, what would the left have been fighting for all year if it ends up being a bill that simply supports and expands the business of private insurance companies, does not provide universal coverage, falls short by 10, 15, possibly 20 million people? That's when we see what the explosion that we would get on the internet is something that we've never seen before in our politics, because as I say, at these legislative junctures in the past, the internet did not exist.
All right, well, we'll see what the internet can do to change the equation, but I think we're still going to have to meet at the barricades one way or the other. Lawrence O'Donnell of MSNBC and the Huffington Post, as always, great thanks.